Hello, now I will tell you about method of lactational amenorrhea. In this, firstly, we have to say to the patient, hello. Uh, we can introduce himself as a doctor and suggestion to the patient. Like sit down, we have to ask for a name and the ease. As that how I can help you explain the information like confidential. That's one. And the second one, the brief history of the patient life. Brief history. In this, we can ask here to the patient. Have to ask to the patient like only for reproductive process and not other for or about everything. We have to propose to them and using joining technology. Asked he or she the patient about the pregnancy, the child birth number of living children, and there is sometime like discussion operation injuries also, and ask that how many children's she wants with the method of a constructions of used in this one. And the third one, uh, interview management interview. It like choose of pose that with the body is relaxed, set of a freedom that turn to the patient. We have to know that what the patient will be held over the attention of the patient to every time, and listen to the patient without interrupting him any useful speech. And like we have to speak choose a little slow and making them meaningful, and sweet conversations on the right topic politely, and she get which we get perfectly or not. Fourth one is active listening. Active listening. In this, we have to check the more complaint and accurate understanding. Said that the patient will be understand sound yes, and downside the ignore, and do not ignore to him or her. And the fifth one is the community. In this, we have to explain the patient about recommended types, method of family planning, and about the positive and negative sides. The sixth one is speech management. Speech management. In speech management, we have to observe the corresponding information and rate of speech during the conversations with the patients. And the seventh one is planning. In this, we have to discuss the select method of consultations of the patient, and avoid the scientific and medical terms, and the planning to have the view point of the view for the patients. And eighth one is the feedback. In this, we have to check the patient feel and ask of the patient repeat some points of instructions or her point of view also. And the ninth one is submission. In submission, we have to ask to the patient if she had any questions or doubt, then she can ask and we have to, if she can say yes, we have to answer him politely and summarize the result to the patients. The 10th one, this last one, is end of consultations. End of consultation. End of consultation. In this, we have to say to the patient goodbye and said that contact us. You can contact to doctor anytime and take care.